sexually transmitted infections (STI). A study in the USA shows that 39% of students have had sex in their lives. In this group, the middle age of having their first sexual experience is being 15, having 2 sexual partners last year. Only the 29% of them always use condoms, the same percentage say they never use protection, the 42% left use it depending on the situation. 5% of the sexually experienced students have been in treatment because of a sexually transmitted disease, and 4% of women reported a past pregnancy. Index. Definition. Most common diseases. HIV and AIDS. How does HIV affect us? Drugs and HIV. Conclusion. Gruffy. Definition. STIs are caused by more than 30 different bacteria, viruses and parasites, and are spread predominantly by sexual contact, including vaginal, anal and oral sex. Some STIs may be spread via skin-to-skin sexual contact. The organisms causing STIs can also be spread through non-sexual means such as blood products and tissue transfer. Many STIs including chlamydia, gonorrhea, HIV and syphilis can also be transmitted from mother to child during pregnancy and childbirth. Most common diseases. HIV and AIDS. HIV is an infection with the human immunodeficiency virus. HIV interferes with your body's ability to prevent and fight diseases, and it can lead to AIDS, acquired immune deficiency syndrome, a chronic, life-threatening disease. At first, no symptoms might be noticed. Early symptoms may appear 2 to 6 weeks later, and they can include fever, swollen lymph glands, fatigue. As the virus continues developing, signs may also develop into chronic diarrhea, unusual infections. The treatment of HIV is called antiretroviral therapy, ART. It consists on a combination of medicines which can help the body destroying infected cells. This treatment does not kill completely the virus, but it can make people live healthier and longer. How does HIV affect us? HIV attacks and kills crucial immune system cells, known as T helper cells. Without T helper cells, which make sound the alarms that the body has been infected, other immune system cells can't work well. If the number of T cells keeps dropping, it can develop to AIDS and the symptoms appear, as it provokes a deficiency in our body's defenses, which makes very dangerous even a simple cold. Drugs and HIV. Alcohol and drugs may cause people to take risks that might expose them to HIV. Sharing needles to inject drugs is very dangerous and can easily spread HIV from one person to another. Addicted to drugs may trade sex for drugs or money to get more drugs, what may put them at greater risk of getting a disease. People with HIV can get infections from using needles to take drugs, which can make them very sick. People addicted to drugs may have a poor nutrition, so they can become sick faster. Drugs can have dangerous interactions with the medicines that people with HIV take to stay well. Conclusion. STIs can be spread by having unprotected sexual contact with an infected person. Unprotected means sex, anal, oral, or vaginal, without barrier protection, like a condom. Some of the ways to reduce your risk of getting STIs through sexual contact include not having sex, being monogamous, getting tested and knowing your partner's status, using condoms consistently and correctly. As some diseases are also spread by blood contact, you should also be careful of not being in direct contact with the blood of people you don't know well.